Yep. Today, we're going to cover a whole bunch of lies, but not for the sake of being down. You know, a lot of today's Natural Health 365 live broadcast, I think, is to really, at least I hope, bring to light some things that just don't make sense. I've been talking a lot to a lot of people in the last few weeks, as you've probably heard. I would say, in the last 2-3 weeks, I was saying to you how I'm going to make such an effort to talk to people more about what they think about vaccines, whatever, face masks, the whole COVID thing in general, just what people's opinions are. Do they think that this is going to go away anytime soon, all on its own? Do they think the government has something to do with playing this up for whatever political reasons there are? I've asked all kinds of questions. I'm wondering what kind of questions that you've asked. And I know it can sometimes be sensitive, right? You talk to people who you think you know, and I don't mean that in any bad way or any funny way. I just mean it in a literal way. You talk to someone that you think you know, you think you're really on good terms with them, and are really super friendly, whether it's family or friends, and then you bring up this virus and boom, it's like it becomes this very uncomfortable, awkward conversation. And I'll be honest with you, I've looked at this in a lot of different ways, a lot of angles. I don't even understand why people get so bent out of shape. I guess it's right there with when you often hear that people shouldn't be talking about, you know what, intimate things. I'll leave it at that. Religion or politics. You often hear that nobody should talk about that with somebody else. I guess because it can be very, very explosive, but maybe now they're going to add to the list this this pandemic thing. And I've done shows in the past that I think resonate with a lot of you in terms of how a lot of this has been a plan of action from early on, many, many years ago. This has been in the works. It's funny, I just reminded myself, in case any of you are wondering, Natural Health 365 live broadcast before I continue on my stories here before the show. Our show is going to start in about 7 minutes. We do this 10-minute waiting period, if you will, where we get this little chit-chat back and forth, which is exclusive for you just before the show. We do this because we want to give people enough time to get notification of the show on their wall. We want to get enough chance for everybody to get online to hear this kind of information because, again, the risk of sounding like I'm tooting my own horn, I just think that information like what we discuss here on this show is few and far between. When you add up all the channels, all the mainstream media outlets, all the papers, all the radio stations, all the TV stations, cable, you name it, and a lot of the stuff you find on social media and through the internet, a lot of it is so much controlled in only one direction. You and I both know what that is. Today's show, and just about every single show of mine, is really geared towards not just for the sake of being opposite or being different, but to really touch on things that I think make a whole lot more sense to you. You know, when you look at these things and you think about them on your own, I think you'll see that a lot of the points I bring out today are going to be worth it for you to look into on your own. And that's another thing that I often say a lot about the information that I put out. I always say, very opposite of what government health officials say, or, you know, leading, quote unquote, leading doctors in infectious disease, what they'll have you believe. I often say, you know, anything that I say to you that you're like, I don't know, I encourage you to not just believe what I say, but to look into it yourself. Ultimately, That is exactly what I want everybody to do. To be able to always freely listen to information and to freely be able to have a choice, whether you want to wear a mask or not wear a mask, whether you want to take a particular drug or not. In conversation with your doctor that you choose for your health care, it's ultimately up to you. And I would say that even to the people who say, oh, Jonathan, hold on. I don't know anything about this enough to make a decision on my own. But you do. Hey, just let me interrupt myself for a second. This table right here, you're going to want to pop out that leg so the table doesn't fall down. Right there. So, I think it's just important. But anyway, I was talking before about how a lot of this stuff that we are, 1 second, let me get Instagram going here. We're going to get started with the show in about 3.5 minutes. So I'm just getting my phone to my camera guy so we can set it up for Instagram. Instagram, YouTube, and Facebook get to access these shows. I want to thank you very much for joining us today. I really do appreciate all of your support. I want to make sure I always say that as well in the pre-show. A lot of your comments, I read all of them, every single one of them. But 99.9% of them, I got to be honest with you, they really do fire me up. They really give me a lot of encouragement. I appreciate you, all of your support, all of your intelligence, the comments that you make, and it really motivates me to keep on going. But anyway, I digress over and over again. You got 3 minutes till the start of the show. Back to what I was saying before about how I know a lot of you feel like this is a planned event. A lot of the concerns about this virus, and we're going to cover a lot of things that I think are going to give the new people out there some food for thought, if you will. They're going to be thinking quite a bit in a different way, I hope, after they investigate it on their own about what this virus is all about and why it has been made into such a big deal. But I had just rewatched a little bit last night. I was thumbing through and I saw, what was it called? Will Smith's movie. Oh, yes. I Am Legend. That was an amazing thing. When you look at that down in, hey, Instagram, thanks for being with us. You're on a bit earlier than usual, but just so you know, we are 2 minutes away from the start of the Natural Health 365 live show. So hang in there, enjoy the little pre-show that we're doing here for, just beforehand, just to get more and more people notified on Facebook, YouTube, Instagram. You're with us too, but we give people enough time to get on board for the live show, Anyway, I was listening to this movie, I was watching it, and when you listen carefully to what they were saying in the movie, it's mind-blowing. I think it was like 8 years ago they did this movie, but it's all about a virus. Will Smith plays a lieutenant colonel, whatever, in the army. He's in charge of viral control and how everybody in New York has been wiped out. He's like the only one, except for the creatures that come out at night. And during the day, they scurry away because, it's funny when you think about it. They cannot stand the sunlight. These zombie creatures that roam around at night and can destroy anybody that might have been alive. They can't stand the sunlight, and these virus-infected zombies, they go run and hide, and they go underground, and they don't bother you. So Will Smith's like the only one out there on the surface of New York City. Everything else has been decimated all by this virus. But, you look at how this was such a, they talk about military and viral research and all this stuff, an outbreak, letting people know for years and years how to watch out for all of these viruses that are breaking out. The outbreak with Dustin Hoffman was about government getting involved in creating a virus. It's just all these movies that kind of get used to it. Anyway, we're going to get started with the show really quick, and let's talk about some things that will hopefully spur you on to look into these things for yourself. Okay, here we go. Thanks for being with us. You're all being lied to. What? misled by the mainstream media. I think a lot of you watching this, you already get that, but today we're going to get into some very key points that'll give you probably some interesting things to talk about with your family and friends. So today, I hope that we expose some really important truths, not only for you, like I said, but so that you could share this show with someone that you love. Maybe it'll open up some more minds out there. No matter what, I encourage you to look into what I'm about to cover today. Let's get started. Hi, I'm Jonathan Landsman, your host for Natural Health 365 Live. We do this show every single day, Monday to Friday, starting at 12 noon Eastern Time. And yes, for those of you who were with me last week at the end of the week, I'm back here in my Florida studio. Welcome. Hey, if you find this information useful, interesting, and you want to get this to somebody else, please do me a big favor and be sure to share this show. Tag somebody in the comments section down below. Email them the show link. You know what you got to do. Just get it out to more people. And you know what? As I always say, don't try to convince anybody of anything, right? All I want you to do is to share it and say to them, you know what? Take a look at this information and let me know what you think. By the way, if you're new to this show, type new in the comment section down below so I can give you a big, warm welcome. We want to know who the new people are to this broadcast. 1 second here. Okay, so just to be clear, and again, I do this for the sake of those who are brand new to my shows. Who's this guy, Jonathan? What's he talking about? To be clear about this infection and health lies that we're talking about, we're going to get there. But to get one thing out of the way right away, there is a coronavirus. There are lots of viruses. It's real. They exist. We get it. Let's put that aside. But how deadly is this? You know, in the mainstream media, their hope, their prayer, their every waking minute is to convince you that this virus is super deadly, super contagious first, super deadly, and it's out to get everybody, from children all the way up to the elderly and everybody in between. I think we can all agree on that. But as I've done on many shows, and I need you to look into this, if you have any doubts at all, look at the accuracy of the deaths. And just in short, I've done a lot of shows on this. If you die of cancer with COVID, you are a COVID death. Has nothing to do with your stage 4 cancer throughout your body. When you pass away, it's a COVID death. That's going to skew the numbers, okay? Heart attacks, car accidents, gunshots. If you die of those, but you're tested positive with COVID, you are listed as a COVID death. I mean, if that alone doesn't stop you and make you think, wait a minute, everybody they say that dies of COVID, it's really dying with COVID? I gotta wonder what's going on here alone with just the death count. Of course, when we move right along, and of course we all heard about deaths at the beginning, way more than now, cases are the big deal. And I've done shows on this as well, where we talked about this truly being a case-demic. That's what we're going through now. A mass hysteria over the volume of cases. But in previous shows, something for you to look into is the fact that public health officials have actually been training local municipalities to do the testing. And again, the testing seems very off as well. Let's leave it at that. Some would suggest corrupt. But to go and sign up for a test and walk away and not even get tested but you filled out the paperwork. And days later, multiple reports, not just like one person in the whole country, getting a letter days later at their home, hey, you tested positive. What? You weren't even tested, but you get a letter because you filled out the paperwork with the intent of getting tested, but you walked away because the waiting line was just taking way too long, so you went home or on with your day. How on earth could you get a letter later on saying that you tested positive? What is that based on? So cases are not accurate. That's my simple point today. Cases are also involved in something that most people don't realize. Whether you get tested and you are positive, whether that's accurate or not, whole other story. But the people you come in contact with for the last 14 days, if you were in close proximity with husbands, wives, girlfriends, boyfriends, brothers, sisters, cousins, work associates, it doesn't matter. If you tested positive, your probable cases, those you came in contact with, are all listed as cases. Whether they were tested yet or not has nothing to do with it. That's the way public health operates in the United States. It's no wonder, is my simple point, that the case number has been shooting through the roof. And of course, the agenda has been, let's just test more and more people. And as another side note to make you think about this a little bit more, doesn't it strike you as odd that this is the only thing that they're obsessed about testing, even if you feel perfectly fine? But nothing else are we obsessed with in this country that we know hurts people. Obesity, we write about it a lot. Hypertension, high cholesterol, poor blood sugar management. None of that matters. You don't have to test anybody until they show symptoms. When they complain about a health problem and run to their doctor, then get tested, that's when it's justified, right? Insurance-based, justified to test somebody and then to treat them. This virus, total opposite. We need to test everybody, even if you feel fine. And if you feel fine, you are a massive potential threat to society. Only this one. Now, I get it. Oh, it's the virus, Jonathan. It's not like high cholesterol. Come on. Don't compare apples to oranges. Then what about H1N1? What about swine flu? What about Ebola? Human-to-human transmission of a virus, influenza, just that alone, for the last, 20 years, let's just throw out a number. Why is it we haven't tested the entire population? Because it's already admitted that this virus alone, influenza, kills tens of thousands of people every year. It is a major health crisis. Big Pharma, the media, makes a big deal out of it, and yet nobody was tested beforehand. Healthy people weren't tested to see if they have influenza. Nobody was mandated to close down their business or cover their face, their mouth, and nose. Why not? Only COVID in an election year. Hint, hint. Okay, so let's move on. We also know that Big Pharma, anybody with a head on their shoulders, and I say that literally, can see that this whole situation is being run beautifully by the pharmaceutical industry. The whole show, along with globalist agendas, no doubt, because it's just weird. When you start looking into the way that all the world leaders talk, it's like they're reading off a script. Imagine if I could say to everyone, okay, world leaders, I would like you all to say that the most important thing for your citizens to do is to go to naturalhealth365.com because it's good for you. And now you go to Australia, New Zealand, the UK, Germany, France, Spain. Every leader says the same thing. Hi, my name is so-and-so. I would like you to go to naturalhealth365.com each and every day because it's that important for your health. And every leader says the same thing. I mean, would you think something's up here? How did Jonathan pull that off? Yeah, I would wonder that too if I were you. But that's exactly, no joke, that's exactly what we have with these leaders talking about COVID. We need a solution, vaccines, and we need therapeutics, and we need much more testing of the population. And everybody says the same three things, almost verbatim, exactly the same, in the same order. That's not a globalist type agenda? Come on. How do you coordinate something like that? Or I should say, how does one possibly in their right mind think that this is not a global concerted effort to have all of them sound the same? And you can see this in various video clips that are out there where you can actually hear in their own words, their own voice, and you can see them literally looking down at a piece of paper. They're reading a script. So they're using Big Pharma, the globalists, that are looking to control and steer society in a direction that they deem fit. Big Pharma is being used. Billionaires like Bill Gates, I've done lots of shows. You got to look into it. Bill Gates has gone from $10 billion in to a $200 billion retrieval of revenue. Are you kidding? 20 to 1 profit on investment? Anybody in the stock market or at banks, if you could yourself get that kind of money, every dollar you put in, you get $20 back, how excited would you be? That's what Bill Gates has been doing since 2010 to 2020 and beyond. His hands, his money, his foundations are behind all the development of the so-called only solution for COVID, a vaccine, in various different companies and industries. And he's in with world leaders as well, just to steer this thing in the quote-unquote right direction. And I've done a lot of shows on this, so you can look back on many of the Natural Health 365 live shows. Look for Dr. Fauci. Look for Bill Gates. You'll see what I'm saying. It'll give you more to think about. And then again, I encourage you to look into it yourself. There are a lot of paid-off politicians. There's no doubt. I don't think any of us would disagree that politicians, they will say on the surface, oh, I love my constituents. I work every day, night and day, for my constituents. Yeah, to get your vote. I care about you. Yeah? What about the lobbyists that pay you money? Does that kind of steer your opinion a little bit? Your political stance on things, the way you'll vote on things? Does that possibly influence you at all? The money paid into your party, into your campaign to get reelected? And there's tons of that, folks. The pharmaceutical industry is heavily invested in politics. So, again, when I say paid off politicians, I don't say it lightly. I think anyone in their right mind can see that's true. And the media is very misleading. We know that. Go to conventional media outlets, the mainstream media, and just listen to the narrative over and over again with a lack of depth, context, and a variety of information from a variety of sources. Look, I'm not trying to be biased just in one way, but wouldn't it be great if each channel, radio station, paper, actually really gave a balanced reporting of the opinions on both sides and just literally said every single report every day, You need to make up your own mind. That would be a great world, wouldn't it? We'd actually have a media, real reporters. So what sparked today's show about lies, lies, lies being exposed? Well, it was the latest news by the Virginia State Health Commissioner, Dr. Norman Oliver. He wants to mandate COVID-19 vaccines for everybody in Virginia. That's right. Forced. You do not have a choice. And yeah, they're kind of weaving in there. You maybe some religious, maybe some medical exemptions. But you know they're trying to bring, 90+% of the population into the belief that they just have to do it. Listen to the language he uses. Quote, "It is killing people now." He's talking about COVID. "We don't have a treatment for it. And if we develop a vaccine that can prevent it from spreading in the community, we will save hundreds and hundreds of lives." Interesting, right? I'm sure those of you who have been following this kind of story and information for a while, you could unpack that quote in many different ways. But it's incredible how this man is completely not up to date. There's such ignorance, whether it's intentional or not, in that quote. Does he know that there is a cure for COVID? Oh, you're not allowed to say that, Jonathan. The experts say there is none. The public health commissioner, this guy I just quoted, he says there is none, but it already existed. It already does exist. There are loads of doctors, and I've done many shows on this, talking about it, but has he spoken to those doctors that have literally gotten millions and millions of views? So you cannot say that, well, maybe he really just doesn't know. I tend to lean on the side of he is intentionally being quite ignorant about the fact that there is a cure. And he doesn't talk to these doctors. He's not curious about it. His agenda is very, very clear, folks. Vaccines. Anyone who will listen to him, just think of a shot in your arm and everything will be okay. It is about as dumbed down a bit of information that he only wants the public to focus on that you can get to. It's obvious. But if the vaccine is the only solution, the thing that we don't even have, then how did China fix this issue? What's going on with China? How come China's not blowing up like it started? China virus, as some called it, right? It came from Wuhan, China, right? This is where it all originated. Okay, fine. Spread through Europe. I get it. Some of you don't like that we call it China virus. Whatever. That's not my point. Let's try to get over that. From Europe, it goes to the United States. Okay, great. Spreads all over. People not wearing masks, let's say, and all these things. Whatever it is you think. My point is still the point. There's no vaccine. How did China get past this? I haven't heard one news outlet say that China is raging out of control. What's going on? Mr. Wang, a senior advisor to China's government, he says this. Here's China's answer. Again, a communist country, quite secretive. We get it. We may not know everything. Listen to what he says. Lockdowns, bans on gatherings, basic quarantines, testing, hand washing. This is not enough. That's a quote. You need to isolate people on an enormous scale in stadiums, big exhibition halls, wherever you can. It seems extreme. It works. End quote. So there you go. That's what an advisor of a communist-led controlled country, that's what he says was the answer. Obviously, more controlling government practices. That's what he's pushing. That's what the world needs to know, what they did in China to the people in China. But no vaccine was mentioned. But is it really necessary? I'm talking about what China did. So now we question deeper, right? Mainstream media would never question, bring up other ideas for you to think about. No. It's just focus, everybody. Need a shot. Shot's coming. Stay under your bed. Stay in your house locked. Cover your eyes, your face, your nose, your ears. Just stay away from human beings. They're going to kill you, God forbid. And just wait for the vaccine. That's all the media wants you to know. Most of the mainstream media, right? Of course, there's exceptions. But how did Sweden... Okay, now we're like, okay, wait a minute. China's not to be really making a whole lot of sense either. What about Sweden? No lockdown. Wait. They did the opposite. The total opposite of China. Not a stitch of a lockdown. And they flattened the curve. How? China said, well, first of all, in the U.S., the mainstream media, hey, the only way we're going to do this is stay away from all human beings and just pray for a shot to come soon. China says, no. Total extreme, like herd everybody, isolate everyone, pull them out of their homes, test them, they're positive, throw them in some of these camps, these stadiums, isolate them, separate them from their families. It doesn't matter. This is what you got to do. And it works. It's extreme, but it works. And now Sweden comes along. And as a country, in late July, okay, Sweden's 7-day moving average of new cases was about 200. 200. That's down from their peak of 1,140 in mid-June. That's a huge drop. And the daily death toll, single digits for weeks. Now, again, put aside how they attribute these deaths. Are they really of COVID or people that died with a positive COVID test? Let's put that aside. Just the number. Come on, what's going on here? It's well below their mid-April peak of 115 deaths a day. Now we're looking at just single digits for weeks. Okay? And what about wearing a mask? Now, Anders Tegnell, I think I'm pronouncing his name right. This is the guy in Sweden responsible for the response to the COVID crisis. This is your lead guy. This is your Anthony Fauci of Sweden. This guy, Anders Tegnell, Tengell, in case you're curious, he says this, quote, are you listening? Listen up. Wearing a face mask is very dangerous because it gives a false sense of security, but does not effectively stem the spread of the virus. What? How does the top guy like a Fauci in the entire country of Sweden, Scandinavian country, how could it be so different from the quote-unquote facts given to us by Fauci? Of course, let's not forget that Dr. Fauci has flip-flopped. You don't have to wear a mask. End of February, you don't have to change anything in your lifestyle. And now it's like, wear a mask and goggles. Like, that alone, forget Sweden, forget China. The fact that Dr. Fauci, your top expert, not mine, I'm going to be honest with you, and God willing, not yours either. This man in late February says, don't worry about anything. Months later, cover your nose, cover your mouth with a mask. It's not symbolic only. It will make a difference. It's important. And wear goggles. And if you're at home, make sure you wear them at home as well. Wow, what a change in just a few months. So, again, Sweden, no vaccine, and this is their position. In the United States, what about South Dakota? That's a little weird, right? In this whole country, you could say, Jonathan, come on, forget Sweden, forget China, forget everywhere else. We got a real problem here, Jonathan. Get on the ground. Get yourself together here. But yet, what's South Dakota doing? Kristi Noem, the governor of South Dakota. She says, oh, I know, for those who believe, cover your head, stay under a bed, stay away from human beings. They are the threat to your existence. What this governor is about to be, I'm going to quote what she said. I know you're going to think she's a whack job. You ready for this? Trust your citizens. Don't lay down mandates. That's what she said. As the leader of the state of South Dakota here in the U.S. right now, in the midst of this hysteria over this virus. Businesses remained open. She told citizens to be smart. And this is so key. It's like you could read it and be like, beep, all right, let me go on with my day. This is where it's at, people. I love this part. I don't know how you feel. She says also, be personally responsible. A government health official, a leader in her state, actually telling the citizens to be personally responsible. I love it. Who's she talking to? 884,000 people that live in that state. How many deaths has South Dakota had? Come on. Somebody throw down a number. Don't be bashful. I looked it up. I couldn't have gotten it right. I'll be honest with you. Big deal. There's no way I would have known on my own. 161 deaths attributed to COVID as a possible cause. I'm telling it to you that way because the reality is, folks, you need to get very real about this. Every death with COVID is a death with a COVID positive test. That's it. Not a death from COVID. None of the death certificates say that. It's with COVID. And all they came up with in the entire state of South Dakota is 161 people. No lockdowns, no mask mandates, no closing businesses, and all of this stuff. Overall, South Dakota is doing very well. How is this possible? When you think of the mainstream narrative, it seems impossible. I know you want to tune me out, but it's real. Now, why doesn't Dr. Fauci call Dr. Risch? You guys know Dr. Risch? Dr. Risch is a professor of epidemiology at the Yale School of Public Health. No slouch, to say the least. Look him up for yourself. He says hydroxychloroquine, and I've done many shows on this, could save up to 100,000 lives if used for COVID-19. Of course, nobody's listening to him. The mainstream media interrupts him every chance they get. When he's on an interview, especially with like CNN, you got to go check out the clips. They talk over him constantly. They do not want him to express his point of view based on an incredible professional ability and experience. They don't want to hear from him. They interrupt him constantly, and they mask over it, tape over him, the mainstream media narrative, making him look like a fool. This man has authored 300 peer-reviewed publications. He holds senior positions on the editorial boards of several leading journals. This is what he said, quote, when this inexpensive oral medication is given very early in the course of the illness, before the virus has had time to multiply beyond control, it has shown to be highly effective, especially when given in combination with the antibiotics azithromycin and the nutritional supplement zinc. All of that, people, not Oh, this doctor's a whack job. He says hydroxychloroquine can cure COVID. What a fool. Ha, ha, ha. You see what I'm saying? Mainstream media would love you to believe that that's his narrative. That's his deal, folks. They lie to you. That is not what he's said. And you can easily find his quotes. That is one that I just told you flat out. And what he's referring to is, he's referring to getting people under 60, the vast majority of the population, early on when they feel a little scratchy throat, little shortness of breath even, right? Which is serious. Don't get me wrong. That is serious. You have shortness of breath. You do not just like turn on the TV and just like have a TV dinner. Like you got to address that. But if you take this early on and you do this kind of treatment of the three, and he's not the only one, you do very well. You stay out of the hospital. You have no other serious, you get over it. You're fine. And that's an epidemiologist talking. Study after study. He knows how to read them. And that's his summary. And there are a lot of other doctors. The American frontline doctors, you have heard about them. Millions of views on the internet. What's the answer? Get rid of their videos. These people are fools. Don't even refer to them as doctors. And I'm not kidding around. They were literally referred to as people. Like not doctors with actual patients that they treated. They wanted the public to kind of hear it as just some random bunch of people in front of the United States Supreme Court talking about how hydroxychloroquine could help. How foolish of them. And again, in context, they don't say that these are physicians taking care of patients and their successes. And they certainly don't allow those videos to stay up. I wonder why. And that's the successful use, again, of hydroxychloroquine, azithromycin, an antibiotic, and zinc. In short, hydroxychloroquine kind of opens up the cell and allows the zinc, the antiviral, safe, natural substance to get inside to stop the replication of viruses. That's an antiviral. And that's how effective zinc can be if it gets inside. And that's why this combo is so great. So they lie. Hydroxychloroquine isn't effective. And they're treating the wrong people, right? When they do it, you got to realize they're very sly about this. They'll take very sick people, extremely old. They already are fully infected and near death. The hydroxychloroquine alone is given to them, and these people pass away. Boo! Perfect. Now we can say hydroxychloroquine, we have evidence. It doesn't work. Out of context, keep everybody stupid. Meanwhile, the more important thing is to get this out to people early on as fast as possible in the right amount and with the other two as well, azithromycin and zinc. So there you have it. It does work in the right amount to the right people soon enough. And that's the thing that the mainstream media and Western medicine is fighting. I wonder why. Does it go against an agenda maybe of popularizing the need and the notion of a vaccine? I don't know. Just kind of throwing that out for you to think about. Now, a similar lie of other therapies, for sure, are blood plasma. Big in the news now, all of a sudden. 100 years old, like whatever. It's been around forever, taking people's blood plasma. You know, people got infected, they feel better. Now you take their plasma, you give it to somebody else. Okay, there's a limit to that. Obviously, you have to get the plasma from somebody else. That's why they're asking for donations now. But giving that to someone else provides some protective benefit. Wonderful. The FDA actually approves this just recently now. And they say the data it has so far, see how shy they are about it, including more than a dozen studies, wow, showed it's reasonable to believe that blood plasma may be effective in lessening the severity and shortening the length of COVID-19 illness in some hospitalized patients, especially those people who get it early. Yeah. You know what they're downplaying, even though the FDA approved it, folks? Because they don't want to give it too much credence. A 35% drop in the risk of premature death. Even Director Azar, a big pharmaceutical guy who runs things at the highest levels of our government here in the United States, is actually saying, folks, do you realize what a 35% drop would be if it was a pharmaceutical drug? Every news station in the world would be playing it every hour on the hour. Take this drug and you will have a 35% less chance of being harmed by XYZ. I'm telling you, it is so obvious. People are being played because most don't have the time to do a little research. And then finally, the last few, vitamin C therapy for sure. There was a 74-year-old woman that just recently had a fever, cough, and shortness of breath. She developed acute respiratory distress syndrome and septic shock. You're talking about life-threatening any hour on the hour. She took hydroxychloroquine, azithromycin. It didn't work. Put on a mechanical ventilation and was given an infusion of high-dose vitamin C. Please keep in mind, we're talking about up to about 15,000 milligrams only. 15. Not nearly as much as what they did in China. And what cancer patients get, like 50, 100,000 plus milligrams dripped into them over hours for treatment, okay? Very helpful. But these people only got that, and guess what? She improved, was taken off the mechanical ventilation, and within 5 days, she got that result. Can you believe this? It's true. This is the first documented case. We need more of them, folks. The higher amounts of vitamin C. Don't take someone 74 years old, fully infected, feeling really terrible. Oh, we gave them 1,500 milligrams of vitamin C. You know, that vitamin C doesn't work. That's the game they play on you. If you believe when they say something doesn't work, the devil is in the details. You got to look a little deeper to really have a better understanding. Vitamin D, Harvard Medical School says, there is some evidence to suggest, this is a quote, that vitamin D might help protect against becoming infected with and developing serious symptoms of COVID-19. Harvard says, we know people with low vitamin D levels, quote, may be more susceptible to upper respiratory tract infections. I mean, where's the news on this? So low levels of below 30 nanograms per milliliter, very simple. Go get yourself a blood test and see if your numbers are below 30. A lot of people are, not a little, a ton. Get your sun exposure, direct sunlight on as much of your body as possible, or supplementation if the sun exposure is not possible. 1,000 to upwards to 8,000 international units, and it may even be more. It depends on your deficiency, depends on your situation. Can be quite an antiviral helper. Giving you the kind of atmosphere, the environment inside that makes it so unfriendly for viruses to replicate out of control and cause you harm. It's that simple. Look it up yourself. But one final thought, okay? So Carl Heneghan, I don't know how you want to pronounce it exactly, but he's a professor of evidence-based medicine at Oxford University in the UK. Let me give you a quote. I am concerned people have become overly frightened, and throughout this pandemic, the fear instilled in people has been a real problem. In addition, he says, and I quote, many people misunderstand and overestimate their risk of COVID. This uncertainty is leaving them highly anxious and affecting schools, offices, and how we go about our daily lives. the government needs to intervene to explain to people their true risk. End quote. Now, of course, between you and me, folks, you would be very naive to expect the government to give you unbiased, truly helpful, healthy information. Those days are over. They run a globalist agenda to just dumb down society so that they don't learn anything significant to improve their health. The bottom line is we have to stop expecting government to help us. That's a lie. Oh, government will save us. Lie. Number one, forget it. Viruses will always exist. They cannot hurt you unless your immune system is down, really down. And it's not a drug deficiency. That is not your problem, that you are deficient in a toxic drug that only adds to your toxic burden in your body, stressing out your liver, stressing out your circulatory system, stressing out everything inside of you. Drugs threaten your immune system, folks. Most drugs do that. Stop getting distracted. Focus on your health. If you're concerned, really concerned, stay at home. But better yet, make some lifestyle changes. Get with a good integrative healthcare provider. Work with them. Get your game together. Consume lots of antioxidants. Avoid sugary foods. Get better sleep. Don't overlook that. I know you don't hear it a lot in the news connected with COVID, but getting good sleep is so important. Avoid fear. How, Jonathan? Get educated. Learn more so that you're less fearful. And of course, most important, I'll finish up with, keep a very positive mindset about your life and your future. A positive mindset is so important. If you're doing anything or listening to anyone or doing anything that puts you in a negative mindset, red alert. That's an alarm. Start shifting gears. Get yourself busy doing things that put you in a more positive mindset. My question of the day, simple. Who should protect you from viruses? Dr. Fauci and Big Pharma is A. B, the government. C, your immune system. Or D, fill in the blank other, you can tell us. Look, folks, I hope you enjoyed this show. If you felt like this information was valuable, please share it with somebody. Tag them in the comments section. Email them. You know the drill. Please get this information out there. God knows more people need to be thinking and looking into these things. And just as a reminder, the Natural Health 365 live show is broadcasted every day, Monday to Friday, starting at 12 noon Eastern Time. Each day, we do this show in hopes to help you improve your immune system, the way it functions, which will automatically protect your health. Thank you very much for being with us. I really do appreciate you each and every day, and I look forward to talking to you again soon. Take care, everybody.